our medical examiner has advised us of a health crisis, and thank you for resounding the alarm. The medical examiner, Dr. Gilson, has sounded in the past, but we're resounding it now because the number of deaths is astonishing. It was awful before, but it's worse now. So it's a true public health emergency, and I thank Dr. Gilson and his staff at the medical examiners who are accurately and carefully tracing the statistics of this epidemic, really, that's reoccurring. His casualties come to the morgue first. They go through police departments and hospitals and end up at his facility. But this is a community fight, and we all play different roles. We want to do all we can to save lives and stop this, educate people, make them aware of what is happening in our community. We prosecute aggressively in these cases. For people who sell heroin to the individual who dies, we have prosecuted more than 24 cases so far, and we've prosecuted for various levels of homicide. And there are many people sitting in the penitentiary because of it. But we cannot prosecute our way out of this case, in this crisis. We cannot prosecute our way out of the deaths and the epidemic here. Prosecution alone will not do it. It adds some deterrent effect, but it's education and awareness that will do it. Education and awareness among the families and the drug users. We know no matter how much we prosecute, this won't stop unless people understand what risks they're taking using these drugs. So education is the key to turning this tide. The county prosecutor's office invested $250,000 over the past 2 years in broadcast and digital education ads for the community and schools. And we set up a website, letsfaceheroin.com, where users and family members who care about the users can get reliable information about the epidemic and treatment option. So we're proud of this effort. And we ask people to look at letsfaceheroin.com. It makes parents and siblings aware of what's going on, what signs to look for. It tells the would-be addict why to stop, how to stop, and how to get help. But we got to work together. I'm going to ask Dr. Gilson to again cover some of the statistics. If you look at the stats which are available, we've got the lowest level of overdose deaths and the most common was fentanyl. We were having, even in 2013 period, there were 5 deaths. So we've gone from 5 directly related fentanyl deaths to 89. And Dr. Gilson reports that were 19 alone in January. So there were almost 4 times as many deaths in January from fentanyl that there were in the whole entire year of 2014. I'm going to ask Dr. Gilson to specifically address the fake doses of the oxycodones and how dangerous those are, and the power and the impact of that drug, because we want to alert not just the police community is aware of it, but we want to alert the drug users and their families about this fake drug and the impact it has. And I'd also like to give you some visuals that Dr. Gilson has talked about. That last year alone, we basically lost 2 plane loads of Clevelanders, people from Cuyahoga County. 2 plane loads. Now, you've got a plane load full of people who died over heroin deaths, and you've got another plane load of people who died directly from the fentanyl, these 89 people. 232 people total. What would we do if we had 2 plane crashes? We'd investigate. It would be awful. We wouldn't want to have two plane crashes again this year. That's basically what we have happening. We're going to have 2 more plane crashes. 2 big planes crashing and all the people dying. I'm trying to get a visual, that something that you can wrap around and put in your head how many people are dying from this. These are preventable diseases and preventable issues. There's a direct correlation between the prescriptions of painkillers and the addictions that come with it to the deaths that are related to the heroin addiction. They march together. As the prescriptions have risen, the heroin addiction has risen. how it works on the street is, as police well know across this county, is in a high number of these cases, people become addicted to drugs from a legitimate injury. They might be they get injured on the job, and they become, a certain percentage of people are subjected or able to be addicted to drugs easily. They become drug dependent. And when the prescription's in, if they have to buy illegal street drugs, they're very expensive. Might be $50 or more a pill. And they can buy heroin at a very low rate, 10% of that cost or lower. So they switch to heroin. Then they get into fentanyl, which has got more kick than heroin. And they end up dead from either the heroin or the fentanyl or both. We want to prevent people before they become addicted to these items and illegal drugs to see